Okay, so great. I'm really sorry for the delay. This was unexpected. We have a really bad thunderstorm here, and there's a power outage, and I'm using our battery backup to do this webinar. So I really hope it will last the whole webinar. It should normally. So yes, so we'll now go into the subject for today. So we continue with the therapies. So I will describe more procedures today, and in our coming webinars we will have Panchakarma also. So it's important to understand that what we are discussing now is not yet Panchakarma. Panchakarma, have all of you heard about Panchakarma? Yes. So in a future webinar, I will be describing Panchakarma. There's a lot of misunderstanding about Panchakarma, and anything to do with oil massage or any therapy is often misinterpreted as Panchakarma, and this is not true. Panchakarma is a very specialized procedure consisting of 5 specific therapies, and you can call it Panchakarma only when you do them in sequence. So what we are discussing so far is not yet Panchakarma, but some of them are preparatory for Panchakarma and some of them are supportive procedures. So what we are talking about basically even now is Snehana and Svedana. That is inducing unctuousness in the body and also doing fermentation. So today we are going to discuss some interesting procedures. For example, we begin with this. I'm sure all of you must have heard of this procedure. This is called as Shirodhara. Have you heard? Have you heard of Shirodhara? This is going to be the first procedure that we are going to discuss today. And as you can see in Shirodhara, we are actually pouring oil on the forehead of the patient by first filling a vessel and then the thread, and then it is slowly moved on the above the forehead of the patient, and then the oil flows and drips onto the head. So this is a very important therapeutic procedure in Ayurveda. And I was asking, have you heard about Shirodhara? Okay. Have you done this? Have you done this procedure yourself? Great. On yourself or on some patients? Okay, some of you are not aware of it. So anyway, it's a very technical. Okay, great. So we will discuss the details of how this procedure is performed and what are its indications and contraindications. And so you can see here the picture depicts the procedure and also the equipment that is used. And today in the market, a wide variety of equipments are available. Some are mechanized, some are not mechanized, some are very traditional, some are modernized. And interestingly, there's also a scientist from Japan. He has developed a robo to perform Shirodhara. So we have also a robotic Shirodhara machine today. And this particular, and the name of this scientist is Baba. So even if you search on the net for Baba and Shirodhara, then you will get a lot of interesting information. And it's very interesting, this robo that he has developed has the ability to not only control the flow of oil, the temperature of the oil, and other parameters, but it can also give you feedback from the body. The robo measures what happens inside the body when you're doing Shirodhara. And Uyi Baba was able to discover that when done properly, Shirodhara is able to stimulate the parasympathetic nervous system. So by doing so, the Shirodhara is able to induce a state of deep relaxation in the patient. So this is a very interesting development. The Shirodhara robo is still not available yet in the market, and it's under research, but I have had the personal interactions with Uyi Baba, and that's why I thought I must mention this. So Shirodhara is coming of age, it's getting modernized, and the results are just being published. So I'm not allowed to show the pictures of this machine, but you can search that in the net, and it's good to know about it. Hello, are you all able to hear? Hello? Okay, so there must be some internet problem on his side. Okay, so we continue. So you can see here, Shirodhara is defined as an Ayurvedic therapeutic procedure in which oil is continuously poured over the forehead, keeping the patient in a supine position, and the vessel is hung from a stand above the head. So this is Shirodhara. This is how Shirodhara is done. Now we will go into the further details. Now, where is Shirodhara indicated? Of course, being an oiling procedure, it's indicated in Vata and Vata dominant conditions, and it's also specifically indicated in individuals needing Svedana, means fermentation, and it's also specifically indicated in psychiatric disorders. And as I was mentioning, it has been found by the Japanese scientists that when you do Shirodhara, then the parasympathetic nervous system is stimulated, and the patient and the person is able to go into a state of deep relaxation. So this can be given in all seasons after taking necessary precautions, and for healthy individuals it can be done anytime. So in Parkinson's disease we use another treatment called Shiro Vasti, which I will describe. Shiro Vasti is more effective in Parkinson's disease. Have you heard of Shiro Vasti? Yes, so Shirovasti is more effective in Parkinson's. Now, if you look at Shirodhara, the contraindications are generally people who are not fit for Sneha and Sweda, in people with predominance of Kapha, Pitta and Rakta, and if there's indigestion and accumulation of Ama, and so these are conditions in which Shirodhara is also not recommended. So this is about the indications and contraindications, and also people with very severe active headache, or people with nasal congestion and such, upper respiratory infections. In such people, we must avoid doing Shirodhara. So now we will discuss about how the patient is prepared for Shirodhara. So again, we have to make sure that the digestion of food taken the previous day is confirmed. Bowels and bladder should be made empty. This is also common for many other treatment procedures, and the patient shouldn't be suppressing natural urges while in the procedure of the treatment. And if there is natural urge for defecation or urination, then the treatment should be stopped and the patient should be allowed to attend nature's call. So these are all fundamental rules to be followed, not only for Shirodhara but also for other treatments. And before the treatment starts, the patient should be in the beginning of hunger arousal. So taking the treatment in an empty stomach is important because Agni and Srotas should be fully receptive when you're doing this treatment procedure. And as with other treatment procedures, we have to light an oil lamp before the treatment starts. So this is about Shirodhara preparation. And if you look at the timing, this is done after 6 a.m. and 4 p.m. And in the mornings, we don't do it after 10 a.m. And in the evenings, we do not do it after 6 p.m. So if we are doing it in the evening, then the last meal should be at 10 a.m. in the morning. And so this is the general, again, it's a general principle for most of the oleation treatments. And so that's about the timing. And now let's come to the procedure. Okay, see, the oil lamp is very symbolic. The light, there are many meanings for this. One is that when you do some action, it should always be knowledge based. So it means, informed action. So it's a symbolic. It's a symbolism that you are doing your action with complete awareness of the situation. You're not doing it in darkness. You're doing it by seeing things. That's one meaning. And the second meaning is that, life is like a flame. And you are trying to protect and preserve life through this treatment. So it's a way to meditate and focus your energies. And Ayurveda says that the fire can amplify your intentions. So when you light the lamp and think about this, that you're doing it with complete awareness, it's to bring and focus your mind and be fully involved in the treatment and bringing in the right intentions, so that it's like a ritual that is done to ensure that the physician takes some time to think about this and has positive feelings towards the patient, wanting him to really get better and all that. So that is the meaning of lighting a lamp. Is it clear? So again, there's some oiling done. The physician or therapist applies the oil on the head, ears, and feet, and then the patient lies in the supine position on the table. So to Shirodhara, it's really important that you lie flat on a table on your back. And then oil is also applied all over the body. A normal abhyanga is done. And then a strip of cloth is tied on the forehead of the patient above the eyebrows. And this is to protect the oil from the eyes from oil spillage. Like the oil shouldn't flow over and then go into the eyes. And so oil is taken in the dhara vessel, and it should be very lukewarm, not very hot, not too cold. And you have to maintain a height between the oil and the forehead. So the oil should be, the distance between the oil and the forehead should be about 4 fingers breadth. So once this is set, the vessel is set, I just showed some pictures. Actually, if there was a possibility for video presentation, it would have been more effective, but you can also see some videos online. But you have to be a bit careful. Some of them are not really very authentic and do not Abhyanga is generally recommended before all the procedures, but in certain situations, you can have exceptions. Because when you apply oil on the head, and there will be some, it's going to create a systemic effect, and there's going to be a temperature, balancing of the body. So Abhyanga before Shirodhara is going to produce better effects on the whole Srotas, because the Shirodhara is not just going to work on the head, it's going to have a systemic effect. So the Vata for Shirodhara to produce a complete relaxation of the body, Abhyanga of the whole body is also helpful. So this is how it is done, and then the oil is moved from right to left and then left to right in semi-lunar motions on the forehead by moving the vessel with the right hand. And so the left hand is used to simply stroke the oil so that it moves down along the hair with the left hand. So both clay and copper are accepted. In fact, even bronze. So what Ayurveda says is that depends on the the ability of the patient, the cost factor. But the thing is, if you want to preserve temperature, then metal is better, because in the metal pot, the heat is retained. In a clay pot, the heat would be lost very quickly. So if you are living in a cold region, then metal would be better. And if you are living in a very hot region, then even clay is fine. So another thing is that the clay pot, we cannot use fresh clay pot all the time, because clay pot will absorb a lot of oil. So if you are using clay pot, then you must use it regularly so that the pot absorbs a lot of oil. And here there's a problem with the clay pot, that since it absorbs oil and you cannot clean it completely, so when you are changing oil or using it for another patient, then there can be some mixing of the previous oil, because in the pores the clay pot will absorb the oil. So if it's a clay pot, then it's better to personalize it. But if you use a new clay pot, then you will lose a lot of oil, because a lot of oil will be absorbed. So generally, we prefer to use bronze or brass. This is what is traditionally used. So So the oil is dripped from right to left and to right in semi-lunar motions on the forehead by moving the vessel actually gently, and then the oil is made to flow over your hairs by stroking with the left hand in a gentle manner. So the recycled oil should also be heated only by pouring into a heated vessel. It should not be directly put on fire. So this is also another important, precaution to be taken. So this is about how the oil is to be applied. And now we will go into the further steps. So again, excuse me, just a moment. So the maximum duration of doing this is 90 minutes, and we can start with 45 minutes on the first day and increase to 7.5 minutes. We discussed this already yesterday for some of the other procedures, and it's the same here. And the maximum is 90. You can start from 45, go to 60, then 75 and 90. And the maximum days this is done, it's about 14 days, but you can also do it for 7 days. So this is the maximum and the minimum for doing this treatment. Now the desirable endpoint is deep relaxation. So this is one of the most important effects of Shirodhara, that if you do it well. I've also used it in some patients with blood pressure in certain conditions, and it has given good results. So it really brings deep relaxation. So if there are psychological elements in a person's imbalance, then Shirodhara is helpful. And actually, if you do Shirodhara properly, you will get lightness of the head, and there will be good sleep. It improves sleep. So these are some of the positive or desirable endpoints that you can expect from Shirodhara. And if things go wrong, then you can end up with headache. I have seen people who get extremely heated up after they do this treatment. There's watering of eyes, heaviness of the head, and feverishness. So these can be, we have to anticipate these problems, and if any patient presents with this kind of a reaction, then we must immediately stop the treatment and do some measures to clear the body of the ama that has been developed. Now, if you were to look at the precautions for doing Shirodhara, then most important thing is that the oil should not be too hot, and the oil should not go into the eyes. This is one of the biggest difficulties that we might face while you're doing Shirodhara. The oil can easily get into the eyes. And to warm up, we should reheat only by pouring onto a preheated vessel. The temperature should be maintained in a constant manner. And for these are the reasons why today people are using some mechanized devices which will, heat the oil, maintain the temperature constantly, and also recycle. So there are many machines that are being made today which can do these things. So, but they are comparatively expensive, and many of them are also available outside India, but if you can get such machines, then I think it's much more easier to control the parameters and the outcomes. So it's very important that while you are doing Shirodhara, there shouldn't be breaks. I mean, the key thing is that the flow has to be continuous without a break. And this is quite challenging. If you were to do it manually, then there are chances that there's a break in the flow of oil. And then this will greatly affect the quality of the treatment. So this is all about Shirodhara. So do you have any questions? It's all clear. Then we can go on to the next. So I've chosen some of these procedures, especially Shirodhara and Shirovasti, because Shirodhara is one of the procedures which is getting extremely popular outside India. And as I mentioned, even many research scientists have been working on this and have developed robots and mechanized it and done many studies to find out what kind of effects it produces on the body. So next we will look at another important treatment procedure, and this is called Shirovasti. And you can see the picture. And in the picture you can see how this is applied. You can also see the variations of the cap. So here you need a cap actually to be worn on the head, and the cap actually captures and keeps the oil column on the head for a specific period of time. And it's quite a challenging task to fix this cap on the head in such a way that there's no leakage of oil. So is any one of you familiar with this procedure of Shirovasti? Has anybody done it or experienced it? Okay. So then it's really very important, but I wouldn't recommend to attempt these two procedures without sufficient training and experience. But it's good to know that these are options, because these can, if not done properly, can cause problems, especially Shirovasti, because in Shirovasti you pour quite a large quantity of oil onto the oil cap. And it means that there's a lot of weight on your head, and the oil absorption happens really because of the weight of the oil column. And so this is Shirovasti pictures, and I will go into the actual procedure. So you can see here also that the patient has been undergoing oil application or abhyanga, so you can see the whole body of the patient is oiled. So you can see here the oil is applied all over the body before the treatment is started. This is again a fundamental. Yes, the patient has to sit for some time. So I'm sorry, I have a slight irritation in my nose, so because I came through the thunderstorm and I was a bit exposed to the rain. So I just take a moment. I just need to clear my face and nose, and I'll just be back in a moment. Okay, so we continue. So, yes, to answer your question, the patient, as once we put the oil on the cap, then the patient is made to sit for a specific period of time and he doesn't move. So, and you were asking about Parkinson's, and actually, after appropriate treatment, the Shirovasti is good for Parkinson's disease. So now we look at indications of Shirovasti. Okay, there's some problem for me. I'm just waiting for the right slide to come. Yeah, we will discuss this. It's just coming. Okay, so now if you look at the Shirovasti and its other level indications, this is indicated in what are predominant conditions in individuals needing showing up of sense organs. It's also indicated in diseases like facial palsy, insomnia, numbness, the nerves, numbness of the body, dryness of the mouth, dryness of nose, cataract, disorders of head and dandruff, and many neurological disorders. It's also indicated in psychosomatic and psychiatric illnesses. So also specific diseases affecting the head and the brain like paralysis, and this is where Parkinson's, multiple sclerosis, all these diseases, Shirovasti is indicated. Yes, in the later stage. For rehabilitation. So these are the indications for Shirovasti, and now we will look at the contraindications. You cannot do this when you have cold and fever, and it's not done in the morning and afternoon. It's usually done only in the evenings, and then it cannot be done when you have diseases of the upper respiratory tract. Yes, it's not much. Oiling the head is done daily in India. So if you use certain herbal powders, it easily removes the oil. And there's also another procedure that the hairs are cut short, or sometimes your head is shaved, tonsured as they say. So the head is tonsured means you completely remove the hair, and that's the best way to do, but sometimes patients are not happy to have their heads tonsured, so then we have to use it with the hair, and we just trim down the hair. But removing the oil is not really that much of a problem, because in India we are doing this on a daily basis, and people use herbal powders to remove the excess hair. So is that clear? So now we go on to the preparation of Shirovasti, how this is prepared. Patient is prepared for the treatment. So the diet is very restricted. We should not allow any kind of indigestion to happen. The patient is not allowed to sleep during the day. The patient should neither keep awake at night and is not allowed to go out. And it's done only after 3 p.m. in the evening. It's not done in the mornings or, because we don't want the temperature to raise after this procedure is done. And that's why it's not done in the mornings or afternoons. It's done only when after the procedure is done, the temperature should go down and not high. So that's the reason why it's done in the evenings. Because otherwise it will cause tremendous suffocation and sweating and heat build-up in the body. So while doing Shirovasti, the patient is not allowed. He has to be completely restricted in his movements and his or her movements, and has to be confined to the room. They're not exposed to the sun or the wind. And now we look at the materials. So you must have seen the pictures which I showed a little earlier, that leather strips of specified size are used, which can be, so we have two options. You can either have a stitched, prefixed cap for the head, or you can, use modern Velcro or some belts to customize it for each patient, that you can tighten it depending on the circumference of the head. That's also possible. And leather strips are commonly used. And what's most important is in sealing this cap, because if you just place a cap and pour oil, all the oil will leak and come and fall onto your face, and that will be a real mess. So the real challenge when you are doing this Shirovasti is to really seal the cap and make sure that there's no leakage of oil. And for this we need black ram. Are you all aware of black ram? So today we are going to discuss some treatments in which we need the paste of black ram. So I don't know what else to call for black gram. Maybe you can check on the net black gram. It's a pulse. So just like green gram, we have black gram. So you can please check on the net and find out what it is, but it's important to know what it is. So yeah, maybe in the future I can also immediately show pictures, but there's no way to share pictures on this webinar platform unless I incorporate it into the slides. So maybe some of these basic substances should be shown. But I'm sure you can find out very easily on the web what is black ram. Yes, I think so. I will just give you a link which you can check. Okay, so here is the link. It's also called black lentil because the husk, the outside coat, is black in color. so that's why it's called as a black lentil. And for green gram, the seed coat is green in color, so it is called as green gram. So when you're doing Shirovasti, you need to have this leather cap, which is customized and fixed for the patient. And then you have black gram powder. Yes, of course. You need a machine. Nowadays we use machine, a mill, to powder it. In India, we get the powder in shops. So this powder is taken and then we add water to it, sufficient water, and then it's made into a duff. And this is placed on the in a it's used to actually seal the cap. So the cap is sealed with the duff made out of black gram, and this ensures that the oil that is poured into the cap does not leak. That's the purpose of using black gram powder. It doesn't have any therapeutic benefit, but it's if it is done properly, then this black gram duff, which you make out of powdered black lentils, is really effective in sealing the cap, and there's no drop, not even a single drop of oil will leak if it is done properly. But this requires a little bit of training, and you have to apply the paste depending on the individual, because the shape of our skulls are slightly varying from individual to individual. So this is just a physical hand skill, motor skill that you develop when you handle a lot of patients. So the experienced therapists can really fix the cap perfectly so that there's no leakage of oil. So then we need, these are the other items that we need. We need medicated oil, cotton, gauze, a gas stove, and then also Rasnadi Churnam, which I explained yesterday, is used to rub on the center of the head after the procedure. And this helps to prevent cold and other problems. So these are the materials that we require, and then so here you can see the caps. There are different types and makes available. So you can see here Velcro is used in one of the caps, and a belt is used in the other to make it tight. And how much ever you try to customize the caps, none of them will fit the head perfectly. So whenever you put the cap, there will also be a lot of gaps between the skull and the cap, and you will need to fill that up with black gram paste, and that's how it's completely sealed. So this is the material that is used. Now comes the procedure of Shirovasti. The patient is made to sit in a chair and keep his back straight, and then a strip of cloth smeared with black gram paste is fixed at the level of the forehead. So you take a cloth and then smear it with the paste of black gram powder, and the strip of cloth is placed around the forehead. Yes. So if you look at the picture carefully, you cannot see the black gram paste. So the black gram paste actually holds the oil at the bottom, and the cap is a layer on top of it. So first of all, a strip of cloth is smeared. It's like, you first apply a piece of cloth on which this black gram paste is smeared, and that is tied on the forehead. And then the paste of black gram is applied inside the leather cap, and it's then fixed on the forehead, and it will stick on to that cloth piece which was blended with black gram paste. And then a strip of cloth is tied securely on this leather strip to prevent leakage of oil. So when you do this, then you can see that the cap is completely secure and there's no leakage. So now the black gram paste is rolled into a suppository and placed on the inner sides of the leather cap. So in this way, the black gram paste is completely applied inside. You make this into a roll we roll the black gram paste, the dough, and then make it into a circular thing, and then it is placed inside. And then the head of the patient is kept straight. So once this is the fixing of the cap. And in fact, when you are doing Shirovasti, the most important procedure or step is really the fixing of the cap. If the fixing of the cap is not done correctly, then the Shirovasti will leak. The oil will leak, and then your whole procedure is gone. So a lot of care has to be taken to fix this cap correctly. And then the head of the patient is kept straight, and the patient is asked to remain like that for a long period of time. So the next slide tells you how the oil is now poured into the leather cap with a small vessel. So you are not supposed to pour the oil directly onto the head of the patient. You must place your hand inside the leather cap and pour the oil over the fingers, and so it doesn't fall directly on the scalp of the patient. The flow is broken and it gently moves in and fills the cap. The oil should be poured from a height of just 2 fingers above the scalp. And the oil should be lukewarm, and while the patient is sitting, we have to replace the oil after some time. The oil, if it becomes too cold, we have to replace it with new lukewarm oil. So the entire oil doesn't have to be removed. A lot of oil is taken and then fresh oil is poured so that the oil remains almost constant. And when the patient begins to complain that there is watering of eyes, mouth, and nose, and that's the point when you stop this application. So now you can remove the oil for once and for all. So the end point is when there is watering of eyes, mouth, and nose. This is the point where you stop applying Shirovasti, and the entire oil is removed, and the Shirovasti apparatus is also removed from the head of the patient. So this is the procedure for Shirovasti. So as we said, as to the prescribed time, the entire oil is removed from the head and collected. The residual oil may be cleaned with the help of a cloth. So if the patient has been tonsured, then it's very easy to do the procedures after removal of the oil, because you can use a cloth and wipe the oil clean completely from the forehead. So tonsuring is therefore recommended wherever possible. And then the oil is also applied on the shoulder, neck and back, and mild massage is performed after this process is done. So this is also because the patient has been sitting for quite a long time. There will be some stiffness in the neck and the back and the shoulders, and this is to release and give some comfort. So the patient, this massage is lightly done on the neck, back, and so then the patient becomes quite comfortable. So after this, the patient is going to bathe in lukewarm water, and then finally again Rasnadi Churnam is applied on the head. So this I explained yesterday is to prevent upper respiratory tract irritations, allergies, and difficulties. So in this way we will complete the performance of Shirovasti. And desirable endpoints are relief from intensity of the disease, watering of mouth and nasal secretions, and induction of sleep. These are the immediate desirable endpoints that you will experience when you do Shirovasti properly. And if you ask for undesirable endpoints, then these are actually headache, loss of sleep, burning sensation in the head, redness of the eyes, and then cold and fever. So these are all the symptoms that we experience if Shirovasti is not done properly. So with that, we have completed discussion on two procedures. So before the break, we will have one more procedure. So we usually take it out with a spoon, a big spoon. And the residual after taking out the oil with the spoon, or you can even use a glass and just dip it inside the cap and remove the oil as much as possible. And the oil that remains, you actually soak a cloth inside, and then the oil is absorbed in the cloth, and then you squeeze the cloth and the oil is removed. And then you again put the cloth inside. So whatever oil that remains there on the forehead is actually absorbed by the cloth. And once you have absorbed all that excess liquid, you can remove the cap. So it's very important to keep this practical thing in mind, that you shouldn't be removing the cap without first completely removing oil, because otherwise all the oil will leak out. So you have to basically wipe the patient's scalp clean of all the oil. So first use spoon to remove oil, and then the residual oil is first absorbed by putting a cloth piece inside and then squeezing the cloth after it's taken out, and then just wiping the scalp free. So this is the way the oil is removed. Yes, the recommended amount of oil, it varies. We can use from 450 ml to even about a liter. and the duration is again varies from 45 minutes to 90 minutes generally. So these are the basic things to understand with relation to Shiro Vasti. And we now go to the next procedure in the first part of our webinar today, and we'll be taking a short break after this discussion. And this is very similar to Shiro Vasti. And here you can see, you can see here the dove. So here in this picture, it's very evident. This is the black gram dove. So you make it very similar like this in Shirovasti also. And in Shirovasti, placed like this above the head, whereas here in this treatment, it is placed around the eyes. So here is a treatment in which oil is retained over the eyes instead of the head. So you can see two, buns are created with black gram dove around the eyes, and as you can see in this picture here, the oil is poured inside. All these pictures very clearly show how oil is poured inside, and this is retained for some time in the eyes of the patient. And even during this procedure, the patient is made to actually blink his eyes. And this procedure is called as Akşitarpana, which means nourishing treatment for the eyes. And here again, you can keep this for 45. Yes, so Akşitarpana is a procedure in which, a therapeutic procedure in which oil is retained over the eyes by making a bund with black gram paste. So if the black gram paste is applied correctly like this, then the oil will stay inside and there will not be any leakage. So now we go into the indications of Akşitarpana, the indications and contraindications. And so, not really. This is beneficial in these, progressive diseases of the eye. It is helpful in in myopia. So it's helpful in this dryness of eyes, trauma to eyes, diseases of eyes caused by Vata and Pitta, loss of hair from the eyelids, redness of the eyes, difficulty to open eyelids, capillary hemorrhage in eyes, and blackouts. So these are the common conditions in which this treatment is administered. And this treatment is contraindicated who has not undergone. So it means purification of the body by Virechana and Snehapana is a must to actually do Akşitarpana. So now we look at the procedure as we described and explained. The paste of the black gram powder should be applied around the eyes, and this is in such a way that a bund is created, which means it completely encircles the eyes, and the height of this bun should be up to 2 fingers. And then usually in the eyes it's not oil but actually the ghee which is used. Medicated ghee is used, and the most commonly used ghee for this procedure is called as Jivantyadi Ghridam. So the medicated ghee should be warmed first by placing it in a warm water bath. So it's one of the ghee, medicated ghees which is used. I just mentioned the name. It's called as Jivantyadi ghee. Then the eyelids are kept closed, and the medicated ghee is poured into this bun by first making it fall on the fingers of the therapist. So just like in Shirovasti, we are not allowed to directly pour the oil onto the eyes because they would be at high pressure, and you have to break the flow of the ghee by keeping the hands of the therapist, and the ghee should actually fall onto the hands and the fingers and then drip onto the eyes. So the ghee is poured and the eyelids should be completely immersed, and that much of ghee should be used, so the eyes are completely immersed in the ghee. And ghee normally is in cold weather, the ghee actually becomes hard, solid. So it's very important that we apply ghee which has been melted. So only melted ghee should be used. And so this can be a little bit challenging in the cold climate regions where ghee tends to become hard or solidifies very quickly. So after melting, and it's also important that for the eyes, no substance should be used very warm. So while we heat ghee, we have to make sure that the ghee is not overheated. It's just lukewarm and very tolerable. And so in this way, the ghee is completely applied. And once the ghee has been completely poured into this bund, then the patient is advised to open and close the eyelids during the entire procedure. So the patient has to close and open, close and open. And actually the total duration of this procedure is not very long, it's very short, maybe 5 to 8 to maximum 10 minutes. And the duration actually varies So it's described in some diseases it's about 5 minutes. In some diseases it's about 3 minutes or 2 minutes, and this is the duration. So the duration is less in Vata diseases and more in Pitta and Kapha diseases. So about 5 minutes is fine. And when this is done, as I mentioned, after pouring the oil, while the ghee, while the ghee is poured over the eyes, the patient has to first keep his eyes closed. Once all the ghee has been poured, then the patient is actually asked to open and close the eyelids. This is very, very important. So while Tarpana is done, the eyelids are opened and closed. And after this is done, after about 5 minutes, then the oil is taken out and the bund is removed. And then the patient should be made to inhale medicated smoke. So when you apply this oil on above the eyes and you retain it, after some time a lot of secretions will come from the nose, and so that is why, to clear up the nose and prevent any blockage, the patient is advised to inhale medicated smoke. And there are some precautions to be followed while doing Karpana, that while you are doing the treatment and for at least 1 week, the number of days you did the treatment, after completing the treatment, you should not look at the sky or bright objects. So you shouldn't be looking at bright sun or bright lights, at least for a month or so. So if you ask when this procedure can be done, then the procedure can be done every day in the case of Vata diseases, and once in 2 days in the case of Pitta diseases, and once in 3 days in the case of Kapha diseases. So this is the frequency of applying Shiro Vasti. And so this is about the procedures related to Akşitarpana. Now, desirable endpoints are that you will be able to, because during the procedure you are in a fairly dark room, so when you come out you're able to adjust to the light without much difficulties. This is a positive endpoint. And then you get clarity of sight. As I mentioned, this is helpful in myopia, short sight. Early stages, we have found that we are able to prevent the progression of myopia. And also in some cases, the people who do this therapeutic procedure are able to reduce the focal length of the lenses that they use. So there's some evidence emerging that this is helpful in stabilizing the structure of the eyes and correcting refractive errors of vision. And then we also feel extreme lightness of the eyes, and these are all the desirable endpoints when you have performed this procedure correctly. And if your procedure is not done correctly, then you have difficulty, inability to face light. In fact, when you just finish it immediately, you will always find that your eyes is not adjusting to the light. So it's okay if you have some difficulty in the beginning. And then if there's blurring of vision, and then there can be heaviness of the eyes, and burning sensation of the eyes, and difficulty in opening and closing the eyelids. These are all indications suggesting that the treatment was not done properly. And so if it's in the middle of the procedure, then you have to stop the procedure and and continue change the procedure and do what is necessary to correct the problem. So this is in brief the three procedures that we discussed are all related to application of oil. Two of them were related to application of oil in the forehead. One was pouring oil over the forehead. This is called as Shirodhara. And then we had the second procedure, which is keeping a column of oil using a cap, a leather cap essentially on the head. And then in a similar way, retaining oil above your eyes. All in both these procedures we use. Hello? Hello, can you hear me? Hello, can you hear me? Hello? Okay. Okay, so then I will just repeat what I mentioned in the end. What do you mean non-organic? We use only plant seed oils for Shiro Vasti, and we basically use sesame oil. Yes, pesticides should be avoided. It can be dangerous. Yes. So those of you who may not have heard the last few sentences that I said, because probably there was an interruption of the sound, I was mentioning that these three treatments that we discussed now in the first part of our webinar today is dealing with nourishment of the organs, stabilizing it. It also precipitates unwanted metabolic wastes and bring them for removal. And these are all coming under the category called Snehana treatment. Hello, can you hear me? Hello? Okay. So we continue with the remaining treatments. And I want to discuss a very important procedure in Ayurveda to cleanse the cranial cavity. And this is called as nasya, or otherwise this is called as the nasal purge. Has any one of you undergone this procedure, or are you familiar with this? Nasya. This is used for diseases of the sense organs, as well as problems of the head and neck. So in this, not only oils, sometimes juice of plants or even herbal powders are instilled into the nose, sometimes blown into the nose, and this causes a response from the body in which a lot of phlegm and unwanted materials are eliminated through the nose. This procedure is called as Nasya, and today we will now discuss about that. So the earlier three procedures which we discussed were basically nourishing, they were all oil based. Now we have one procedure which is cleansing. And actually Nasya is one of the procedures of Panchakarma. And we will again come back to this in the context of Panchakarma in a forthcoming webinar. But compared to the other Panchakarma procedures, Nasya is more easy to implement. The procedure is comparatively simpler, and I'm discussing this separately because we are dealing with procedures that are dealing with the head and the eyes, and now because nose is very close to these organs, I'm just discussing about that. So let's get into the details of Nasya. So Nasya, or nasal purge, is an Ayurvedic therapeutic procedure in which specific medicines are administered through the nasal cavity. And these can be either nourishing or cleansing, or it can even be palliative. Now, in Panchakarma, what is part of Panchakarma is only the cleansing Nasya. But other types of Nasya are not part of Panchakarma. So that's the importance of Nasya. Nasya is both included within Panchakarma and it's also an independent therapy. So when Nasya is done for cleansing, then it becomes part of Panchakarma. So this is Shodhana Nasya. And when Nasya is done for nourishment or for pacification of the doshas, then it is not strictly, or it is rather not at all part of the Panchakarma procedure. Now, the nasal mucosa is very vascular, which means it's rich in blood supply, and so even certain herbs, if you apply it through the nose, it gets directly absorbed into the bloodstream and produces systemic effects. So Nasya is almost very similar to a parenteral route of drug administration. And through Nasya, you're able to even manage certain emergency conditions. So people who go into a coma, who lose consciousness, who are affected by poisoning and also snake bite, in such conditions, medicine is instilled through the nostrils to revive the patient as an emergency measure. So the logic here is that the medicines will get absorbed through the nasal mucosa and enter into the bloodstream, and it will very quickly reach the brain and the vital organs. So the administration of medicines through the nasal route is really a method for emergency medication. So Nasya is multifaceted, and that's why I chose to discuss this even outside the scope of Panchakarma. So Nasya is a procedure which can be used as an emergency route of drug administration. And Nasya is also used for cleansing the cranial cavity. And this, as I mentioned, is part of Panchakarma. The Nasya is also used for other purposes. So this is an overview. Nasya is a multifaceted route of drug administration. So has any one of you got any experience in using Nasya? And as I told, in Nasya we can use many things. We can use fresh juice, we can use oil, we can use ghee, we can use powder. All these substances are used to do Nasya. So anybody experienced in doing Nasya? Okay, good. So what type of Nasya have you done? Anybody who has done Nasya as part of Panchakarma? Okay, so what type of Nasya was it? Is it for cleansing or is it for balancing? Oh, it's difficult to get one Nasya to do all the three. What medicine was used? Did you use any oil or herb juice? What was used? Okay, no problem. Fine. I'm not interested in knowing all these details. It's just to know at what level of exposure you have, so that my questions are basically to understand to what level of detail I should actually explain. So that's the reason why I'm asking the background of your experience. Like if you are totally unaware of the procedure, then I have to deal more with the basics. But if you already have some basic exposure, then we can go a little bit more into the details. So that's the reason I'm asking. Fine. So this is Nasya. So I hope you got the point that this is multifaceted. It's used for multiple purposes. And all types of Nasya do not have the same effect. That's the bottom line. Now, if you look at the indications for Nasya, this is indicated in diseases that's affecting the head and regions above the neck. And the purificatory or cleansing Nasya is to be done when you have headache, heaviness of the head. So this is also applied in diseases like migraine. And when you have problems of the upper respiratory tract, so in conditions like sinusitis in specific stages, after preparing the patient, Nasya is done as a cleansing measure, and then the accumulation of mucus in the sinuses is removed through Nasya. Then it's also recommended in edema of the sinuses, then lymphadenitis, tumors, skin diseases, epilepsy, and all these problems. So it's important to know that Nasya has both local and systemic effects. Some of the Nasyas have very localized effect on the head and neck region, and some of the Nasyas have systemic effects on the whole body. So, nourishing type of Nasya is sometimes done in Vata type of headache, where there's loss of voice, migraine, dryness of nose and oral cavity, dysphasia, loss of strength of eyelids, as well as frozen shoulder. So even in many neurological diseases, nourishing nasya is given. And palliative nasya is to be given in warts, discoloration of skin, and diseases of the hair. And in fact, in Ayurveda, some of the treatments for early graying of hair loss, nasya is an important treatment. Actually, nasya is not a complete treatment for tumors. It's only part of the treatment. So it's part of a more comprehensive treatment plan, and in a certain stage to cleanse the head and neck region, nasya is also administered. So its effect on tumors is, as you said, it's only the purificatory nasya which is used in tumors, not all the types of nasya. And the purificatory is indicated in tumors affecting the head and neck region. That's where nasya is used to cleanse the system. So nasya shouldn't be misunderstood as a frontline main treatment for tumor or cancer. So that's about nasya, and these are the indications for nasya generally. And then we will now go on to where nasya shouldn't be used. So there are a lot of contraindications for nasya. In fact, in Ayurveda, there is a special oil called Untitled. And Untitled, the word means that it penetrates into the minute channels of the body. That's what the word means, Untitled. And this Untitled is actually recommended for application every day as part of your daily routine. So if you are regularly using Untitled, then your sense organs are in better shape, your eyesight is preserved for longer, your voice, when Anu is Sanskrit, and it is in Sanskrit it sounds, let me see, it's like the na in 9. So it's how you pronounce na in 9, the first capital, the N in 9. That's how you pronounce. No. And anu means atomic or minute. So here it means it goes and penetrates into the atomic spaces of the body, the minute spaces of the body. And that's what Untitled means. So this oil is recommended for daily use, and using a few drops of this oil is considered to be preventive of even early graying of hair, loss of hair. So it completely tones up. It's good for the teeth. It's completely good for the head and neck region because it maintains the normal circulation and the neurological functions. But except for this, other types of nasya are not recommended for regular application. Only the use of Untitled nasya is allowed, on a regular basis. Other types of nasya to be done with caution. So here are a lot of contraindications for nasya. People who have consumed poison, alcohol, or a large quantity of water, they should not take nasya. Because nasya improves circulation quite a lot and it promotes a lot of secretions. So if you take nasya along with poison and alcohol, then the effect of the poison and alcohol is enhanced. And when you have drunk a lot of water and if you do nasya, then a lot of secretions can come and clog the srotases. For these reasons, nasya is not recommended in these conditions. Now, nasya contraindications also, you should never do nasya when you have indigestion or soon after the intake of food. If you have had a big meal, for that matter, I think you must have realized by now that in Ayurveda, none of the treatments are recommended, after taking food. So almost all the treatments, except a type of Vasti, we will come back to that, all these treatments should be done on an empty stomach. And you should perform nasya actually before a head bath and not after. So it's done before your bath. And if you have too much of hunger and fatigue, then you are not allowed to do nasya. And in very early stages of fever, and if you have acute running nose, then nasya is not allowed. The modern nasal drops, decongestants are applied when you have active rhinitis or active running nose, but Ayurvedic nasyas cannot be used when you have acute running nose. You have to do other treatments like steam inhalation and other things. And you must also not do nasya when you have your natural urges are very active. Persons who are debilitated by excessive indulgence in sex, persons who are extremely sorrowful and depressed, in very small children or in very old people, or immediately after childbirth, this procedure is not allowed. It's a bit strong and it can also cause a little bit of sneezing. And so even in pregnant women, you have to be a little careful with doing nasya, because if the pregnant woman sneezes too hard, it's not good for the fetus in the strong intra-abdominal pressure that comes and affects the uterus. So that's also not allowed. And if you have any indication of hemorrhage or after bloodletting, you should never use. So if you have frequent nosebleeds, then you have to be very careful about using nasya, because most of the nasyas will actually increase the vascularity of the mucous membrane, and it can aggravate bleeding if you're having epistaxis. So you shouldn't be using it if you have hemorrhage. Except, sometimes there are some herbal juices which you can use to stop bleeding. So you have to be very, very choosy when you do nasya when there's bleeding. The only purpose for which its use is justified is to actually use any substance which can prevent bleeding from the nose or stop or arrest bleeding from the nose. And when you have acute cough and asthma, that is while you are coughing, it's good for preventing cough and asthma, but not good in the active management of these conditions. So, because when you are having active asthma and when you're trying to do nasya, it can be extremely stressful. A lot of phlegm will be precipitated and it can even aggravate the condition. So nasya is given only in the remission stage of the disease. And then we should not also administer nasya soon after administering of enema, or which is called as Vasti in Ayurveda. So these are all the conditions in which nasya is contraindicated. So in people who are eligible to do this treatment, you can go ahead and first prepare the patient. And again, this is very common and similar to all the procedures, but still, for the sake of, clarity, I have to briefly mention that the digestion of the food consumed in the previous day should be ensured. The bowels and bladder should have been cleared. The natural urges shouldn't be suppressed. And in between the treatment, if there is some stimulation of the natural earth, then the patient should be allowed to attend to it. No treatment should be done in Ayurveda by suppressing your urges. So if you have too much of sneezing or too much of urge to urinate or to defecate, and then the treatment should be stopped. And then you have to attend to these natural urges and then come back. The reason is that otherwise Vata will get aggravated. And now you need to also arouse hunger, which is just mildly bearable, and then light an oil lamp before the treatment starts. So this is all about preparing for Nasya and then the timing. So for Kapha diseases, we can do Nasya in the morning. And for Pitta diseases, it can be done in the afternoon, and for Vata in the evening. And in healthy persons, we can do this in the morning, during autumn season and spring, and in the cold season, it should be done in the afternoon, the evening, during hot seasons, and when the sun is very bright during the rainy season, we should do it only when the sun is bright. And it should not be performed in extreme weather conditions, like if you find that the weather is very erratic and unpredictable, then you shouldn't be performing or doing Nasya. And this procedure should not also be done when the sky is very overcast, if there's too much of clouds, and so this is specifically contraindicated. And in conditions where Vata is aggravated, like hiccup, convulsive disorders, locked jaw, loss of voice, it should be performed even twice a day. So except in few diseases. So these are all very technical things, and I don't think you should try applying it in all these serious diseases, because you need to be really well prepared to face the consequences. So this is very specialized, and only an advanced medical specialist can do it. But still, it's important to know that in very rare situations, you can even repeat the Nasya twice a day, but in other cases it's generally advised once in 2 days because of its intensity. But as I mentioned, the use of Anutailam as a prophylactic, that is allowed every day. And unless the weather is really very bad, you can apply that Nasya in at least once a day. So this is about the timing of Nasya. Then we go ahead to the materials. I mean, how will you prepare for doing Nasya? So we have to keep all the materials available in a vessel, and you need vessel and water for fermenting. You need cloth for fermenting. Now this is the important part of Nasya, that you cannot just take the medicine and directly pour it into the eyes of the nose of the patient. You have to actually prepare the patient by a little bit of oil massage and fermentation. This is important to open up all the channels, and Nasya also, as I mentioned, has not only a local but also a systemic effect. So you have to take the vessels for collecting the discharge from the nose. When you apply medications in the nose, you have to anticipate that the patient is going to clear a lot of phlegm, will come out from its nose and mouth. And so this will have to be continuously collected by keeping a vessel near the mouth and the nose of the patient. So as the Nasya medication begins to work, a lot of secretions will come to the nose and the mouth, and the patient will need to spit and clear it. So a vessel or dropper, in ancient days they used to have a vessel, a small vessel with a pointed tip to pour the oil, but today we also have droppers to take the medicine and instill as drops. And then you have napkin and measuring vessel. And so these are the material that you need to get started with Nasya. Now, an actual procedure for Nasya is before even applying or putting the oil drops into the nose, we should apply the oil on the forehead, face and extremities. And then you have to foment the face and forehead very well. And then the patient should be asked to lie in a supine position. So you have applied oil to the forehead and the face completely, and then also to the hands and the legs. And you have to keep the hands and the legs extended, but the head should be slightly tilted backwards. You can use even a small pillow to help to do this, so that it's easy to drop the Nasya solution into the nose and that it will go inside without any difficulty. Now we have to massage the palms and feet very well. So vigorously the palm and the both palms of the patient and the feet of the patient should be rubbed very well. This is a very, very important procedure to stabilize the movement of prana and enable the Nasya to really, facilitate the removal of the doshas. So this massaging of the hands and feet and fomenting of the face and the forehead, these are very, very important, preparatory procedures for doing Nasya. The medicine is now, after this massaging is done, the medicine is now instilled into the nostril by closing the other nostril, and then it should be instilled in the other nostril in the same way. One is closed and the other is closed, and it's instilled one nostril after the other. And if any complications come, like there can be severe sneezing, which is uncontrollable, so this can be sometimes problematic, and you have to immediately handle that. Sometimes there can be bleeding. These are rare occurrences. It happens only if you choose the wrong patient, one who is not suited for Nasya, or you use a wrong medicine which is not suited for that person. These are the only situations in which you will face complications. But if you have planned it well, you've chosen the patient correctly, the medicine correctly, then there are no chances for any complications to arise. So after this is done, the patient should be made to smoke. Now it means that after you have applied the Nasya and the patient waits for some time, as I mentioned, he will throw up a lot of the secretions. A lot of phlegm is usually seen. Sometimes thick white mucus is coming out after Nasya, and you will get quite a large quantity of this paste, and eventually it will come to a stop or standstill. And then the patient is made to smoke. This is now to dry up all the secretions that come into the mouth and nose after Nasya. There will be continuous secretion. So smoking with medicated herbs is recommended as a procedure to be done after Nasya is performed. Then the patient should also do some gargling to clear the mouth, because a lot of these, after Nasya, a lot of secretions come into the mouth, and by gargling you can remove them and make the mouth completely clean. And then the patient should take hot water, even drink hot water, and fresh and warm for during the treatment period. And too much of unctuous or cold food should not be consumed. And the patient can also remove the oil on the face and the hands and all that by a mild bath immediately after the treatment is over, and the secretion have actually come to a stop. Now we look at the desirable endpoints. If you do Nasya properly, then immediately you can experience that there's clarity of sense organs. So this is something which the patient will report to us. There will also actually be freshness of the mouth, and after each procedure of Nasya, there will be relief from the diseases, and at least the symptoms will become little relieved, although the disease may not get completely cured. And the patient will feel really lightness of the head and neck after removal of all this waste substances and secretions. And if you are going to look at undesirable endpoints, then there is headache. Nasya, if it's done wrongly, can produce very severe, nasty headaches. So I have experienced this in some patients, and even myself personally experienced problem. Issues of head cold and fever and malfunctioning of the sense organs. These are all the problems that you can experience when Nasya is not done properly. So then we move on to the precautions. So I've introduced Nasya, which is a very important procedure as part of Panchakarma and also done independently. Unlikely if the procedure is done properly. So the application of oil, fermentation of the face, massaging of the hands and feet, all these are very important. And the patient will have already taken some internal medicines. A lot of ama has to be cooked first, and the preparation of the patient is really very, very important. So if you have prepared the patient well, then definitely you cannot expect any major problems. So headache happens only when you have not really, prepared the patient well or applied the medicine correctly. So this is the thing. So we continue. The precautions are, no, actually there is no duration. It's the dosage of the medicine to be instilled. How much of the oil or the juice we should instill. So if you are using on a regular basis just 2 drops is fine. On a regular basis. If you want a real strong cleansing to happen, you may have to apply 6 to 8 drops of the medicine. If you apply 6 to 8 drops, then you get a very strong reaction. So if the person is pitta and if their mucous membranes are not so strong, if it easily bleeds, then you should not use very high dosage. So there is no duration for Nasya. Nasya is very simple. That not simple as such, but the procedure is very straightforward. You apply oil on the face and the forehead, and you apply steam fermentation, and then you rub the palms of the hands and the feet, and then you pour the oil inside. And after the oil, the actual dosage of the medicine is instilled in the nostril. Then the patient will have to just lie down and the medicine will start to act. Some medicines can cause some burning sensation. This is normal. Some medicines can cause temporary irritation of the nasal pathways. This is also normal. And as the secretions come out and it is cleared, so the physician does not control the duration of the treatment. It happens, you have to wait till the patient finishes clearing his nostril. All that the physician controls is the dosage of the medicine. That is in the hands of the physician. So if he controls the dosage, the reaction, the impact of the medicine changes. So if he uses a very heavy dose, then it's very strong. If he uses a small dose, then the response is not as bad. So this is the method. So we are not supposed to use cold water for drinking or bathing while you're doing nasya. So the patient should be completely put on the use of hot water. The patient should not be allowed to move around in the sun, wind or dust. So usually nasya is a treatment which is done by hospitalization, or the patient has to be confined in his home. Yes, it can be done, but panchakarma cleansing is usually done with oil. Now, plant extract or plant juice is used very rarely, and it's very strong, so we have to be very careful in using it. And I wouldn't recommend using plant juices, unless you are well experienced in handling it. So there are many oils which can be used. They are very gentle and don't cause much problems. And one of them is Anuthilam. So I would only recommend using this oil. So head bath shouldn't be taken just before or after performing the nasya. This is again important. And during this whole course of treatment, you must completely avoid the use of alcohol. So these are the precautions to be taken while you are doing nasya. And with that we complete nasya. So do you have any questions? Nasya is a very, very important treatment procedure in Ayurveda. And that's why I have discussed this along with other treatments for the head. And you can see that the dosage, the type of medicines, and then the procedures have to be followed very carefully to make sure that it doesn't produce any unwanted effect. So with that we complete nasya and move on to the next procedure. And you can see from the picture, this is called immersion steam bath. The patient is immersed in a tub of medicated, and boiled and heated water or decoction. And this is the procedure. And you can see this is the picture of how this happens. So the immersion steam bath is an Ayurvedic therapeutic procedure in which sweating is induced by immersing the patient in hot water boiled with medicinal leaves. So here you really boil the water with a lot of medicinal herbs, and then it is poured into a tub, and the patient has to immerse his especially the hip region is kept completely immersed in the water. The patient sits for some time. And this is also done usually after Abhyanga. And it's not advised to be done without application of oil in the first place. And this is really very, very interesting and very powerful treatment. And recently we had an experience of, a disease called Fowler's syndrome. So this is a disease in which the urinary bladder goes into a stricture. The sphincter fails to relax. So in this condition, they usually use an implant for neurological stimulation of the sphincter. So you have to do a surgery to correct this. And we have a personal experience in our hospital of a patient who was advised to undergo this surgery, which was very expensive. And the patient came to us, and we did some treatments, and one critical treatment was this Avagaha Sweda, or immersion steam bath. And for the first time in months, actually the patient passed urine while sitting inside the tub. So its action on Apana Vata is very profound. So this treatment is also found to be effective in diseases, of the low back region. It's effective in hemorrhoids and many such conditions. So we will learn a little bit more about Avagaha Sweda and how this is applied. So this is the indications are general in Vata dominant conditions for inducing Sweda, and it can be used in all seasons. But the key thing here is that it's indicated in diseases in which Apana Vata is affected. That's the key thing. Hello? Can you hear? There was a power. Yes, it is back. So as I told you, the thunderstorm, my battery backup suddenly had a problem, and now it's just restored. So I'm sorry for that interruption. So I hope you're able to hear me now. Can you all hear me? Okay. So we continue. Somehow it worked. So yes. So it's a typo. It's actually typo error. Actually, it means Apana Vata. So by mistake, when I typed, it became Vatra, but it's actually Apana Vata. Okay, so is this clear? It is Apana Vata. Okay, so I hope you're aware of what is Apana Vata. Yes, it's the Vata that is working in the, in the back and in the umbilical region, is connected with the functions of the uterus, the excretory organs, and all that. Yes, so Avagaha Sweda, or immersion steam bath, has an effect on the Apana Vata. And as I was saying, in a case of Fowler's syndrome, we had dramatic results by using this. And now we see the indications of Avagaha Sweda is in conditions which are affecting this region. Now, there are people who cannot tolerate heat or fermentation, and people who have a dominance of Pitta and Rekta. In such patients, we shouldn't be using this treatment. And also, this should never be done on a full stomach. All the treatments are to be done on empty stomach, and especially this particular treatment should be done only on empty stomach. It cannot be done when there's indigestion and accumulation of hama. Now here are some tips and tools about how to locate and prepare the space for doing this treatment. A spacious room, ventilated and lighted, but not disturbed by strong wind or direct sunlight, with the head pointing towards the east. This is where the treatment has to be done, and the digestion of food consumed the previous day should be ensured. Bowels and bladder to be empty, and no natural urges should all be attended to, and all those general principles, and lighting an oil lamp, so focusing your energies and getting involved in the treatment. All these are general preparatory procedures. So once the patient has been properly prepared, then we have to get the materials to do this. So you need a very large bathtub or large vessel. So most of the time the patients are already having some pain or mild disability, and so it's very, very crucial that you choose a tub into which the patient can enter without any difficulty. So it should be a tub into which the patient can step in very easily. So it should be quite big and comfortable. And then you need a stove to heat the herbal mixture, and a cloth strip to dry over the patient's eyes so that the steam doesn't affect his eyes. Then there are very specific herbs which are indicated for use in doing this immersion steam bath, and these are the leaves of Vitex negundo, Calotropis gigantea. You can look up these terms on the net and find out the plants, because if you type the botanical names, then you can actually find the plants on the net. So Ricinus communis and Datura neteo, these are all the herbs and the leaves that are used to boil the water, and into this water the patient is made to sit. And you need some oil for the head and for the body, and the patient is again subjected to oil application. And you must have noticed now again that in all our treatments, oil application on the body is a preparatory step, and without doing that the patient is not subjected to any kind of treatment. So these are the materials, and then we come to the actual procedure. You boil water with all these leaves that we mentioned, and then the boiled water is filled in a bathtub, and then the physician or main therapist applies oil on the patient, on the head, ears, and then the whole body, and the strip of cloth is tied on the forehead above the eyebrows again, is to protect the eyes and prevent dripping of sweat or oil into the eyes. And then the patient should lie down in a supine position if you have an elongated bathtub, or most of the times we ask the patient to step into the bathtub and sit comfortably in a huge vessel till sweating is induced. So that's the duration for which the patient is made to sit inside the tub. And once the sweating has been induced, the patient should come out of the bathtub, and any residual oil should be removed using the herbal bath powder. And the patient should bathe in warm water, and all the oil then should be removed from the body. So this is the procedure. So you heat up the water with all the herbs, and then it is tolerably warm, and then you ask the patient to sit inside and then wait for the sweating to be induced, and then the patient is made to come out of the bathtub, and all the residual oil is removed. So this is essentially the procedure for immersion steam bath. Now the patient should remain in the bathtub till sweating is induced, but before too much of tiredness sets in. And another important thing is that the patient should not be made to sit inside the bathtub to the point where the water that has been poured has become cold. Now this can produce many unwanted effects if the water inside the tub becomes cold, and then the whole purpose is defeated. So we will have to pour fresh water, maybe remove a little water so that the temperature of the liquid in which the patient is sitting inside the tub is maintained constant. And after this procedure, again to stabilize Apanavata, a little bit of laxation is recommended. Laxative decoction is administered early in the morning, just before the treatment or immediately after the treatment, depending on the condition of the patient. And this is another procedure. So while the treatment is done, a little bit of gentle cleansing is done for the patient. Now these are the desirable endpoints. If you've done this procedure correctly, then you will find immediately a reduction in pain, stiffness, and other symptoms. So even in conditions like low backache, in which the vertebral discs are affected, this treatment is administered, and you will find that there's reduction in pain, stiffness, and other symptoms. And there's induction of sweat, there's relief from fatigue, and if it's done properly, the patient also gets good sleep, and there's also free bowel movements and urination after this treatment is performed. So all these endpoints enable us to understand that the treatment has been effective. And the undesirable endpoints are actually thirst, palpitation, shivering, dryness of mouth, heaviness of body, headache, giddiness, and sensation of heat increasing in the body. So these are all indications that the treatment has not been performed properly. So thirst and palpitation come if the body gets overheated. Shivering will come if the body gets too cold, that if the water inside the tub becomes very cold. And there are signs of dehydration like dryness of mouth and all these giddiness and sensation of heat. These are all indicating that the procedure was not done properly. And now there are some precautions that need to be followed. That we have to ensure that the patient is comfortable and not in pain or discomfort in the bathtub. And here you see that the water is not hotter than individual patient's level of tolerance. So balancing the heat is really very important. And warm water should be administered with sugar and salt to prevent dehydration if the patient feels tired. So these are the general precautions that we have to take when we do Avagaha Sveda. And so here is also very, very important treatment protocol, which is very helpful in diseases of the lower back, the urinary bladder, uterus, the spine, and all that. So in our last webinar, I am planning to present a few case studies. So in our next webinar, we will deal with Panchakarma, the 5 major procedures. And in the last webinar, I want to present some case studies, because there you will really understand how on individual patients these treatments are done, and what is the effect on specific diseases. So I think that kind of a case study discussion will also be helpful for you to appreciate how these treatments are actually applied in clinical practice and what kind of results we get. So I am thinking of using the last webinar on this topic to illustrate through case studies the actual application of these procedures. So now we come to the last procedure that we will discuss today, and this is the application of medicated paste. In Ayurveda, application of medicated paste is a very important treatment. It's done in a wide range of conditions, from muscle spasm, inflammation, edema, to soft tissue injury without open wounds. It's also done to improve complexion of the skin. It's applied on skin diseases. There's quite a wide range of application of this medicated paste. So you can see here the medicated paste is applied, and they're very different. Some are very wet, some are slightly dry, and their thickness also varies, and all these things change the effect of this treatment procedure. So application of paste is called lepa in Ayurveda, and this is an Ayurvedic therapeutic procedure in which sweating is induced locally by applying a medicated paste on the area. So herbs are powdered or they are ground into a fine paste, and the principle here is that the paste should become really soft, like butter. So we have to grind the herbal powder or the herbal ingredients by adding water to such a fine state of consistency that it feels as soft as butter. So that's the principle. So this treatment becomes effective. The key for the efficacy of the treatment is the fineness to which you are able to grind and make the paste. So if the paste is very granular, and if it's not very smooth, then it doesn't really produce the necessary effect. So grinding is a very important preparation for application of paste. And now the indications of paste is in Vata or Vata dominant conditions, in joints where there are inflammation and swelling. So this is a very effective treatment for local inflammation and joint pain. So this is done in diseases like rheumatoid arthritis. It's done in osteoarthritis. It's done in ankylosing spondylitis. It's done in conditions like fibromyalgia, and it's done in certain skin diseases like psoriasis or eczema. So there are a wide range of conditions in which medicated paste are applied. It's also applied on the head to induce sleep. It's used as an application on the head in psychiatric diseases also. And so these are the general indications for applying lepa. And if you're going to look at the contraindications, then it's contraindicated in open wounds in people with highly sensitive skin. And one of the biggest problems with lepa is that in some individuals can create skin irritation. Am I audible? Can you hear me? Okay. So in open wounds, we cannot apply this medicinal paste, and in people with highly sensitive skin. So you have to be a little careful. Some of the herbs can cause skin allergic reactions. So it's always better to test on a patient before, applying on a larger area. And some people are allergic to certain types of herbal powders and pastes, and so we need to look into that factor and use it very carefully in patients. And you cannot do this also on very heavy stomach when food is being digested and there's accumulation of ama. So these are the general contraindications of the LEPA treatment. And then we come to the preparation of the LEPA for the patient for the LEPA. And again, these general principles are applicable here, that digestion, the food should have been digested, bowels and bladder to be emptied. Always the body should be in a basal state when you're doing treatment. The body should not be in an active or stressed state. That is the principle. The body should be in as much as relaxed basal state physiologically, not only the patient's psychology, but the body should be physiologically also in a state of, stability and balance. And that's why this is given so much importance. And again, you have to light a lamp before the treatment starts. And these rituals also help the physician to get focused on the patient, and the patient also is induced into a state of deeper relaxation, which will produce better results. So it's quite well known that if the patient is stressed, extremely stressed and anxious, then these treatments will not be very effective. These treatments are more effective when the patient is really comfortable. So a lot of counseling and interaction with the patients is needed, to ensure that the treatment works. So now the materials for making the LEPA: you need a vessel to mix the paste and warm it. The medicine is a paste form, or sometimes it's a microfine powder, which you then immediately, mix it with a liquid, which could be water or honey, so you can keep the material already as a paste, or you can take the powder and make a paste just when you're going to apply it. So both these options are possible. You need a stove and a warm water for washing and some fluids to mix the powder. Many fluids are used to make the paste. So even cooked rice water is something which is used to make a paste. We may make paste with the milk. We make paste with, buttermilk. So depending on the condition of the patient, we may use honey. And all these substances can be used to prepare the paste. So that's all done based on the condition of the patient, the actual imbalance of the doshas. Taking all these factors into consideration, you can choose different types of fluids to mix the powder and make a paste. So now we go to the procedure for LEPA. So when you do this procedure, actually, you have to keep the patient comfortably. Depending on the area on which you're going to apply this LEPA, the patient should be comfortable in a supine or a sitting position, and the prescribed medicine should be taken in a powder form or as a paste. And then if the powder is taken, then we should mix it with the fluid which is prescribed by the physician. So as I said, this fluid can be many things: plain water, boiled water, rice-cooked water, milk, buttermilk, honey. All these things are, used, depending on the condition. And then the paste is applied on the affected area, and the normal thickness is the thickness of one finger. So the thickness is increased depending on the dosha. If it is a vata kapha condition or a kapha condition, then thickness is more. Because if the thickness is more, then more heat is trapped inside. So that is why in Vata Kapha and in Kapha condition, we need more heat to be trapped inside. And that is why you apply the lepa more thickly. But this is a principle to know in Pitta condition, the lepa, the paste should be applied very thin. It should be thin, because in a Pitta condition, if you apply a thick paste, then the heat will get trapped and the area will become very, very red and hot. So this is also one of the ways to know which dosha is involved. So if you apply a paste thick on a Pitta condition, heat will increase. And you apply it thinly on a condition of Vata Kapha or Kapha, then it will become more stiff. So the thickness of the paste itself will change the action of the paste. So that's really very, very important. The applied paste is kept up to the prescribed time, which is usually you keep the paste until it dries. And as it dries, we just scrape it off and clean the place. That's the usual time. But in some people, in some seasons, the paste may not dry up. So usually you can just leave it for 20 to 25 minutes. And then you can remove it if it is not dried up, and a maximum of half an hour, and not more than that. If you keep for longer time and the paste gets extremely dry, then it can contract and cause discomfort on the skin. Now after this is removed, the area should be washed with warm water. And if the paste has been applied on the head, then after the procedure is over, we have to apply what I call, earlier yesterday I told the Rasnavi Churnam, which is a herbal powder which is used to prevent, the congestion in the nose and cause cold and other problems are prevented when you apply Rasnavi Churnam on the head. So this is the procedure for the lepa. So the duration is, as I told, sometimes variable, but generally speaking, half an hour, or the time the paste becomes dry, whichever is earlier, and or if the patient begins to sweat and feel lightness of the affected limb, then we can also remove the paste. And you can just wash the area with warm water and remove the medicine. So when you are applying lepa, this is one condition in which oil application is not done. So you must have seen in all the other therapeutic procedures, we had to apply the oil before you did the procedure. But in medicated paste, you do not apply oil before the paste is applied. And for that reason, after the powder or the paste is removed, we can just wash that area with warm water, and that is sufficient. Now we look at the desirable endpoints. The desirable endpoints are relief from symptoms. There's balance of temperature in the region. Like if you apply the paste correctly, then the local temperature of the region, it doesn't become too increased or too decreased. The balance of that region is really stabilized. That's really very, very important. And then you will find immediately there is a reduction of local symptoms like redness, swelling, and pain. So these are indications that will confirm to us that the application of the paste has been appropriate and correct. Now the undesirable endpoints are skin irritation, then itching, then eruptions, and sometimes that area where we have applied this becomes excessively hot or cold. So these are the undesirable endpoints of the application of medicated paste. And so this is the summary of how medicated paste should be used. So I'm glad that my battery has lasted this webinar, and I'm actually running on reserve battery, so it's really, so I did also do a little bit of hurrying up towards the end to make sure that we complete this. So with this, we have completed all these procedures. Do you have any questions? Has any one of you applied this paste before? Okay. So this is interesting. So now I would like to complete the Panchakarma and explain it very clearly in the next webinar. So with that, we will get a complete idea of the major therapeutic procedures that are used in Ayurveda. And in the last webinar, as I said, we will deal with some case studies, because I found by questioning that many of you have not even tried out some of these treatments. You don't have exposure to these treatments. So in that case, it's really very, very important to, understand how these are applied in actual clinical practice. I can show some outcomes in patients, how they improved, especially in skin diseases, where you can see pictures of the change before and the after the treatment. So with this, we are concluding, and we'll continue next week. And in 2 more webinars, we'll complete the therapy procedures. So have a good day.